Welcome to part 5 of nursing practice questions and answers about musculoskeletal problems in the adult client. Now let's start with the first question. A client with diabetes mellitus has had a right below knee amputation. Given the client's history of diabetes mellitus, which complication is the client at most risk for after surgery? So these are the options. Option A, hemorrhage. Option B, edema of the residual limb. Option C, slight redness of the incision. Option D, separation of the wound edges. Now, for this question, the correct answer is option D, separation of the wound edges. Now, let's move to the rationale. Clients with diabetes mellitus are more prone to wound infection, wound separation, and delayed wound healing because of the disease. Postoperative hemorrhage and edema of the residual limb are complications in the immediate post-operative period that apply to any client with an amputation. Slight redness of the incision is considered normal as long as the incision is dry and intact. Now let's move to the second question. The nurse is caring for a client who had an above knee amputation 2 days ago. The residual limb was wrapped with an elastic compression bandage which has come off. Which immediate action would the nurse take? So these are the options. Option A, apply ice to the site. Option B, call the primary healthcare provider. Option C, rewrap the residual limb with an elastic compression bandage. Option D, apply a dry, sterile dressing and elevate the residual limb on one pillow. The correct answer for this question is option C, rewrap the residual limb with an elastic compression bandage. Now let's move to the rationale. If the client with an amputation has a cast or elastic compression bandage that slip off, the nurse must wrap the residual limb immediately with another elastic compression bandage. Otherwise, excessive edema will form rapidly, which could cause a significant delay in rehabilitation. Now let's move to the third question. A client is complaining of low back pain that radiates down the left posterior thigh. The nurse will ask the client if the pain is worsened or aggravated by which factor. So these are the options. Option A, bed rest. Option B, ibuprofen. Option C, bending or lifting. Option D, application of heat. Now for this question, the correct answer is option C, bending or lifting. Now let's move to the rationale. The nurse assesses the client to see whether the pain is aggravated by events that increase intraspinal pressure, such as bending, lifting, sneezing, and coughing, or by lifting the leg straight up while supine. Now, in my presentation, my reference book have used Saunders Comprehensive Review for the NCLEX-RN examination 9th edition.